Our next speaker is Professor Ragini and Professor Anjali Chandra. Chandra will look into Salutogenic Hospital for Promotion of Health in India.
Good morning, everybody, all the members present. I'd like to take this opportunity to thank Professor Allen and the organizing committee to give us an opportunity to represent India and Wellington Institute of Management. We belong as faculties to the Department of Healthcare at V School. So whilst I was listening to the morning talk, there were mentions about inclusivity. There were mentions about socio-cultural and economic alliances with design as well as functionality. And that's what we are also trying to showcase over here as academicians, as knowledge partners towards contribution of an integrated approach for the evolving health system in India. India as a nation is undergoing transformation, which is not only in terms of trying to meet or bridge the gap of equality and accessibility, but also trying to bring the international benchmarked practices into health services delivery. So I'd like my colleague, Professor Anjali Kumar, to walk through you through a research that we have done as a focus group discussion with some of the hospital leadership in Mumbai, in India basically, but morely from Mumbai.
Thank you. The topic which we are going to present is the Salutogenic Hospital, Inclusive Designs for a Promotion of Health and Wellness in India. The objective of the study was to study conceptual understanding about the salutogenesis on the patient well-being in Indian setting. As we don't have a lot of research which has been done on this subject in India, hence it was more of a desk research for us. The second objective was the awareness of salutogenesis as a contributor to customer satisfaction, and we interviewed healthcare consumers, hospital administrators, and owners for the results to come up. Talking about how the country and how the world is going, the population of India is increasing day by day, and it is almost equivalent, rather now more than China. So that's one of the reasons why there's a need for change and a need for better healthcare facilities in India. If you look at the diagram in the right-hand side, you can see the population, the middle-class population would be equivalent or probably higher than the US population as per the stats goes. Indian healthcare and Indian people are changing. There's a lot of transformation which have been brought. So people are now looking out for technological advances. There is a demographic shift. People are moving from different parts of the world back to India. There's an even global economic shift. And this is what youth is preferring right now, more of technology coming into picture. The Indian healthcare setup, when it started, it was a very basic setup where you had primary healthcare, nursing home, and secondary care hospital. But now, with innovations coming in, private partnership coming in, we have more of tertiary care hospitals and quaternary care, which are the specialized clinics in different ailments. During our survey, we took the consumer perspective, where we saw most of the consumers go to healthcare facility because their doctors have referred a particular facility to them. Though the preference is given what doctor says or a clinician says, they never evaluate options when they are picking up their own healthcare facility. So this is something strange, though in other countries people do evaluate options, but in India, they blindly follow what clinicians actually say. When we looked at the non-clinical factors, which is more regarding environment and access to the hospital, the maximum people said they look at a brand reputation when they are choosing a facility, followed by ambience and access route to reach hospital, and then hospitality of that particular service and wayfinding. This is some of the pictures from the Indian hospitals, how patients or the relatives wait in the areas. So somebody probably is clueless. There is no, people are actually watching at you, so you can't do much of it, right? There's no privacy when you are sitting in an area. You have people sitting idle or with their mobile phones. So this is the only way people spend time when they are into a healthcare facility in an Indian scenario. So psychology of waiting is stressful and mind and body is not relaxed. The majority of the work which people do are either they are sitting idle, ticking fingers, biting nails, or staring at others. Most of the time people keep doing this when they are waiting in a healthcare facility. When we went to hospital administrator, we found 3 types of analysis. The first one was priority care, how they give priorities to the delivery. And they said India is now, all hospitals are going ahead with accreditations. They have national as well as international NABH and JCI accreditations, which most of the hospitals are obtaining now. So they said quality processes and compliance to regulatory norms was top priority for them. So if I have to look at a care delivery, this is the most important part, followed by cost control. It has to be a cost-effective measure if I have to come up with anything new in my hospital. The non-clinical environment stood important for them, and for them, hospital ambience played an important role, followed by hospital environment, which is smell and feel, so that they gave importance to this. But they again said that it has to be a cost-effective measure. So if my bills are increasing because I have to provide these non-clinical factors, then probably I will not be in a position to do. And they also said that though these things can be introduced in Indian setting without increase of cost, because it does not cost you much if you have these environmental friendly options available to you. In patient care areas, the first priority for the hospital administrators were to address the anxiety of patients, try to have a good patient safety environment, and strategic initiatives with customer segmentation and others. This is a response which we got from the hospital administrators, who said that 80% said that they receive suggestions from the customers about how the environment of hospitals should be. And out of them, 84 said they do all these things, so they do take care of ambience, they do take care of environment, but they are not aware of the word salutogenesis. And they have yet not studied much on what is the effect of environment on a patient well-being. So they are doing everything. So you will have greenery, you have the best of facilities available, but you actually don't know that this word salutogenesis is coined up and how it is actually helping the well-being of the patients. The third response which we got was design features and expense to be best avoided in hospitals, and 72% said there won't be any expense if we actually introduce a lot of design elements in a hospital setup. I would now request Dr. Ragini to take you forward from here.
Yes. So thank you, Anjali. So taking you back to this, we are just copying, we are just aping. what the others are doing, and it is a competitive race. India, as she has shown you already, that there is a corporatization of the health system which has occurred from the year 2000, last 15 years, which has happened because of the return of the practicing clinicians who worked with Cleveland and the other NHS academies and all, and they are now returning back. So they are just aping what they have seen the environment over there. And they are not really aware about the science of salutogenesis when it is being applied to well-being and sort of employee-friendly benefits out of salutogenesis. So also when we asked, is it a cost to you? They said it wouldn't be considered as a cost, provided you are giving me low-cost design, and which is relevant to the Indian setting. This is just what I would like to show you. It is about when I studied my medicine. So I'm a clinician and a management professional. I was a hospital administrator myself, worked in Dubai and other countries, and coming back to India. So when I studied, the focus of healthcare was predominantly only on clinical excellence and practice of medicine, scientific. There was no customer focus that was given. Customer focus was considered only in terms of feedback to recovery from his ailment. But over the last 15 years, and I could say that over the last 3 to 4 years, probably, we are seeing a shift in the consideration of the customer features and customer expectations from a service delivery process. And hence, I couldn't think of a better image but the iceberg, which clearly reflects that, yes, India as a country is emerging, and there is a shift in the focus towards the efficiency, cost-efficient factors which are important for consumerism in healthcare. This is just some of the models which I would like to show you. Like, whilst we are saying that, yes, we have emerging models, this is a public-private partnership model. This is a hospital in Mumbai, central Mumbai, very close to the airport, where the government had stakeholder partnership along with a private player, and this private contributor is a returnee from one of the American systems. However, they are still struggling due to the political features, where he said there were political and socio-economic and demographic factors to be considered. They are still struggling, but in terms of design, they are one of the best designs in central Mumbai. So they have a good spacious design, they have a nice lobby, they have a beautiful, the largest parking space probably in Mumbai, lovely escalators in the lobby. However, still struggling to break even and come out of the political issues. This is another feature where they have tried to bring in the greening concept. Now, because of the JCI compliances, we are very careful about the green aspects which are not there in the patient zones. However, they are there in the administrative zones or in the OPD basis. So this is, and then the wooden furniture which is included. That's the main lobby. So how big is the lobby over there? This is a private practitioner. So I'm just showcasing you different models where we are saying inclusivity. Healthcare is seeing transformation from the chains of hospitals, the big giants who are there, like the Fortis, the Apollos, and now the Hindujas who are coming up. And you have got individual practitioners who are medical practitioners, but because of the FDIs that are coming into India, the investor body which is interested in participating in the evolving health transformation, they are getting the funds available to them for going in medically led business practices. And this is a pediatric practice. We have written a case on this, where he is putting up at least another 20 hospitals across the, it's called as the Bimaru states because it is Bihar, Madhya Pradesh, Rajasthan, Uttar Pradesh, where the highest disease burden is there. So he's putting up these hospitals there. This is one of the ICU setup where it is a patient waiting area. This is one of the hospitals which is near the sea-facing and the bed pod system and the ICU in individual settings that can be seen. It's a quaternary hospital. This is a trust-owned hospital where, again, you can see the design scapes that are being involved into the ICU and the pediatric settings. And what I want to propose through this is, when we are talking of inclusivity, it's not only disability or it is disease inclusivity, we are also talking about practice inclusivity. The government of India is now focusing on integrated approach towards healthcare, and Ayush, which is Ayurveda, Unani, Siddha, and homeopathy, and yoga. These systems have to be integrated, and there is a proposal of smart cities where 100 smart cities are going to be put up across India. So we are, the lower three boxes are depicting the requirements The shift is happening into primary system, and there is a scope for development of infrastructure and an integrated approach that you should look at it. This is just to show our example of an Ayurvedic garden in the hospital, which was a trust-owned hospital. This is the terrace garden that they have. So that's what we had to share with you from the academic side. Thank you very much, and you are very much welcome back to India and to V School. Thank you.